Hello everyone, welcome to Dental Mate. First of all, thank you for this beautiful and abundant family. Today, in this video, we'll be talking about lateral periodontal cyst. So, what does the things suggest with the name lateral periodontal cyst? First of all, lateral means it occurs at a lateral position. It is seen in a lateral position. And periodontal means it has to do something with the periodontium and not with the tooth. Okay, so one thing is there, although cystic condition is seen in a lateral position of the tooth, but the tooth is vital here. Now, if we talk about introduction, so what are the points you need to write, or you can write in introduction is, lateral periodontal cysts are the cysts which are confined to those cysts that occur in lateral periodontal position. So this is the lateral periodontal position, and in this position, the cysts which are occurring, these are known as the lateral periodontal cyst. Along with that, there are certain other criteria, which are, there is no inflammatory etiology and there is no diagnosis of collateral OKC, clinically and histologically. So, what are lateral periodontal cysts? These are confined to those cysts that occur in lateral periodontal position and in which inflammatory etiology and other diagnosis of collateral OKC have been excluded on clinical and histological background. So, this is what is known as lateral periodontal cyst. This is a developmental odontogenic cyst. It occurs in the lateral surface of the roots of teeth. It is also known as the intra-bony counterpart of gingival cyst of adult. Okay, so lateral periodontal cyst is commonly referred to as the intra-bony counterpart of the gingival cyst of adult. Now, if we talk about the etiology of lateral periodontal cyst, first of all, its origin. It can arise either from the remnants or rests of dental lamina, from reduced enamel epithelium, or from the cell rest of molasses. Okay, so these are the three different originating factors for lateral periodontal cyst. How does the etiology progress for this cyst? First of all, there occurs expansion of the follicle on lateral surface of the unerupted crown of the tooth. So here, this is the oral epithelium. The tooth is not erupted and there is expansion of the follicle on lateral surface of the crown. After that, if we take a radiograph at this stage, then the radiograph will show that this is a lateral dentigerous cyst or the collateral type of dentigerous cyst. But when the tooth erupts in the oral cavity, we get to know that the tooth is not impacted. Hence, this is suggested to be a lateral periodontal cyst. So here, this is not an impacted tooth, rather this is an erupting tooth which is associated with a dilated follicle. So in the later stages, what happens is the tooth erupts leaving behind the follicle and consequently forms or assumes the shape of lateral periodontal cyst. So up till now, we have seen two features of lateral periodontal cyst. First is that the pulp of the tooth is vital. Second, the tooth is erupted, not impacted. Now next, if we talk about the clinical features of lateral periodontal cyst, the most common sites in which it can occur is mandible, that to premolar, canine and lateral incisor region. So it is most commonly seen in mandibular, premolar, canine and lateral incisor region. And on vitality testing, the pulp is vital. So the tooth is vital. There is nothing non-vital in the tooth, but there is a cystic lesion which is present associated with the periodontium. Next, if we talk about the radiographic features, then it is mostly unilocular, but occasionally it can be polycystic or multilocular. Now, when it is multilocular, there are several cystic spaces seen separated with fibrocellular septa. Okay, so these are the cystic spaces. These are seen separated with the fibrocellular septa. This is known as the multilocular or the polycystic type. And this appears grossly as clusters of grapes. Okay, so this appears as clusters of grapes. Now, if we talk about the histological features of lateral periodontal cyst. So there is a formation hypothesis which is given according to the histology which is seen. What happens is, first of all, we have the cyst and which is lined by the epithelium. So here the cyst is lined by a thin epithelium which resembles the reduced enamel epithelium. Then what happens is the early epithelial lining gets thickened by the proliferation of the basal cell. So here there is a basal cell. So यहाँ पे जो basal cells हैं, they start to proliferate and there is thickening of the epithelial lining. Along with that, there is continuous proliferation of the basal cells, due to which there is swelling of the there occurs fluid accumulation inside the cell and these cells swells up. Okay, this gives rise to the characteristic histological feature of lateral periodontal cyst. So this is the characteristic histological feature which is seen in lateral periodontal cyst. First of all, if we look at the cystic lining, the cystic lining is 2 to 5 cell layer thick. It has thin, non-keratinized stratified squamous or cuboidal cells. It is made up of reduced enamel epithelium. The nuclei is small and pycnotic, and the cells are clear glycogen-rich cells. So these are the characteristic features of the cystic lining. It is 2 to 5 cell layer thick. It is made up of thin non-keratinized stratified squamous or cuboidal cells. of the reduced enamel epithelium. The nuclei is small and pycnotic, and the cells are clear with high amount of glycogen. Along with that, there is focal nodular thickening or localized epithelial plaque which is seen in the histological feature. What is it? It is the focal epithelial thickening, focal nodular thickening or localized epithelial plaque which is seen. Now, what are these cells? These are basically fusiform cells. These are also clear cells with pycnotic nuclei. These are also rich in glycogen, but these fusiform cells, they have their long axis parallel to the basement membrane. So, the long axis of these fusiform cells, they are arranged parallel to the basement membrane. Now, if we talk about the treatment, similar to other cysts, the treatment of this cyst is also either enucleation or marsupialization, depending on the size of the cyst. Thank you. I wish you all happiness and success in life.